All right, and we are live. All right, so thank you all for joining us. This is the Tel Aviv West Hollywood City-to-City Strategic Dialogue discussing HIV/AIDS and the HIV Zero strategies and the 90-90-90 strategies from our city partners. Rabbi, do you want to greet us? Rabbi Egger from Congregation Kol Ami.
Hi, everybody. We're so delighted to bring you the City-to-City Dialogue in honor of the 40th anniversary of the discovery of the AIDS virus, and to really focus on what we're doing about prevention and cure, not only today, but in the future, in the city of Tel Aviv and in our own city of West Hollywood. And so we're delighted today to have these leaders with us, and it's our pleasure to co-sponsor this day with the Consulate General of the State of Israel and the Consul General Hillel Newman, who joins us today. Hillel, welcome.
Thank you, Rabbi Egger. It is really, truly a pleasure to take part in this event, to join with you, such distinguished partners. Thanks to all those who have joined for this important conversation. Allow me to start open with the recognition, first of all, of course, the two municipalities of West Hollywood and Tel Aviv. We have the deputy mayor from Tel Aviv online and the representatives of West Hollywood. I'd like to also recognize the distinguished panelists with me, which is, of course, Council Member John D'Amico, Congregation Kol Ami, and Dylan from ICANN, and, of course, you, Rabbi Egger. We just celebrated Israel's 73rd Independence Day, and I can think of no better way to mark this miracle story of Israel than to bring us together and unite Israel, Tel Aviv, together with Los Angeles, West Hollywood, around such an important topic as the one we are going to discuss. The friendship and connection between Israel and the city of West Hollywood is deep, and the partnership is wide-ranging. We have joined forces over issues of mutual concern and interest, ranging from water conservation to LGBTQ rights. The establishment of an Israel-West Hollywood HIV/AIDS task force in 2014 created a new and vital dialogue, focusing on scientific collaboration, research, and sharing of clinical best practices. Today's event is a demonstration of this ongoing relationship between the State of Israel and the city of West Hollywood regarding this global issue and other issues. Israel, at just 73 years old, has become a global leader in innovation and a powerhouse in ingenuity. This is true also for the biotech field. Israel has been at the forefront of biotech R&D for decades. Great advancements have been made in almost every aspect in the biotech and life sciences sector. Looking forward, we are confident that this will include also potential major developments and breakthroughs in treating COVID-19 and HIV/AIDS. We will be glad to cooperate with the city of West Hollywood on a wide range of issues. We appreciate the friendship and cooperation with this wonderful city. Greetings again to ICANN for arranging this. Thank you all for those who are attending what promises to be an important and compelling conversation. Thank you, Rabbi Egger.
Thank you so much. We're so delighted always to partner together. And so it is our privilege and honor to welcome our very own council member, John D'Amico, of course, amazing activist, amazing leader of our city. Welcome, John, and thank you for being here.
Thank you very much, Rabbi, and thank you for inviting me, Dylan. It's nice to be here with the Consul General and the Deputy Mayor. It's hard to believe that 40 years ago, HIV was brought into the lexicon. It was brought into our consciousness, and even that 7 years ago, West Hollywood joined in this effort with the State of Israel around the epidemic, including, as was mentioned, ideas around prevention and education and research. And I'm just happy to be in this conversation on behalf of the entire City Council and our mayor. West Hollywood is a tiny little city, about 30,000 people in Los Angeles County, which has 10 million. We are surrounded by the city of Los Angeles and the city of Beverly Hills, and yet we have always remained a sort of progressive bastion where everyone is welcome. In fact, the city was started by a coalition of Jewish immigrants, gay and lesbian and seniors. We all got together and decided we needed to separate from the county and become our own separate city where we could develop our own policies around the same time, that was in 1984, as the terrible beginnings of the AIDS epidemic. So West Hollywood has been a city that has only known AIDS, and we have done our best as a city to be in the game at every turn. And now it's exciting now. You'll hear from my colleagues, the city staff members, who will be bringing up our HIV Zero plan a little later. But I just want to say again, thank you for including us. It's part of our DNA to include others, and it always feels good to be included. So thank you very much.
Thank you, Councilmember D'Amico. Rabbi, you're on mute. There you go.
Thank you so much that you're here with us and such a strong partner and advocate for those with HIV and AIDS, not only in our city, but in our country. And it is my great pleasure today to also introduce my good friend, longtime friend, Chen Arieli. Chen is the past chair of the Agudah, which is the national LGBTQ organization in the state of Israel, and also now has been the deputy mayor for the City of Tel Aviv. Chen, welcome to the dialogue.
Welcome, everyone. I'm so happy and honored to be here. Welcome, Consul General Neumann. Welcome, Council Member D'Amico. Welcome, of course, Rabbi Eger, my dear long friend, and Dylan. Welcome to everyone who's watching us. I think that the past year have taught us, after the struggles of challenges of the past year, taught us a different meaning of the word solidarity and collaboration. And we're talking about the solidarity and collaboration between West Hollywood and Tel Aviv. We have a lot to talk about. I think that from my previous visits, I always felt at home and always felt welcome. And I'm looking forward to seeing all of you in West Hollywood or here in Tel Aviv, Yafo, of course. I'm sure that our friendship, our deep friendship and collaboration will rise not just in the important subject that we're going to talk about today, which I won't I'll talk about it now because I will talk about it a bit later in the panel. I really believe that as family cities, sister cities, I like to call it family cities, it's most important thing to do is to learn and to collaborate and to ask and to do know-hows between those cities, because we have a lot of similarities between the cities and the characteristics of the cities, and the possibility to learn out of a deep friendship is the whole world itself. I think that every one of us, especially in the last year, felt much closer and united to the mutual challenges we all faced. And I'm sure that this deep friendship will continue many years ahead in many topics and subjects that life will bring us, and hope for eventually that everyone will get outside of the different squares and really to hug and connect in person, as we all miss and really need as human beings. I wish all of us good health. I wish that COVID-19 is behind us. I really hope that the world and especially our cities learn the values, the deep values of solidarity and neighborhoods and deep caring for one another. And thank you so much for inviting me. I'm honored to be here. Thank you.
Thank you. Thank you so much, Chen. We want to focus our conversation at this time specifically on what is happening in each of our communities around HIV prevention, education, to the populations of both Tel Aviv and West Hollywood. You've both been instrumental in making sure that our municipalities are addressing this issue, even if this last year of coronavirus, when so much attention, rightly so, has to be on the prevention and of transmission and the treatment around the coronavirus of COVID-19. But we can't lose sight of the pandemic that all of us, the four of us, have been in this fight against AIDS and HIV for a long time. So maybe, Chaim, let's turn to you and tell us a little bit and explain to everybody who's watching today about the 90-90-90 plan that's part of the municipality of Tel Aviv. And then, John, we'll invite you to talk about the West Hollywood Zero plan. And we can then have a conversation about the similarities, the differences.
Sure, I would love to tell it. The Fast Track Cities program, what we called in short 90-90-90, actually Tel Aviv joined that program 3 years ago. It's an international plan that's called Fast Track Cities, and the goal is to stop the HIV infection the HIV virus that caused to the HIV disease. We actually joined this this project that already joined the 62 cities around the world, and I wanted to share a bit what is the program meaning. The program that kind of known in the word is, it's easy to remember 90-90-90, and you in a minute will understand why, because if you remember the 90-90-90, you remember the core of the plan. The three super goals of this program are 90-90-90. 90% out of people who are living with HIV will know their HIV status. Second term, 90% of all of the people who live with HIV will get a medical care, and the third goal is 90% of out of the people who get medical care will reach to a point where their virus level in the blood is so low until they're undetectable. So it's a situation where the chances of contracting the virus are zero. So it's actually those three steps: 90-90-90. 90% of people living with HIV will know their status. 90% that know the status will get the medical care, and 90% out of the medical care will get zero detach contracting the virus. This project actually recruits large cities in the world out of the perception that a big part of contracting the HIV virus is happening in a big metropolitan cities around the world, such as West Hollywood, such as Tel Aviv, and without a recruit of big and central urban centers, alongside with governments and medical research and care and NGOs, the fight for ending AIDS won't be complete. So being a part of that project means that the city gets really close guidance out of the international network by building a work program to demolish HIV, and out of that is learning from the 62 cities that are a part of the program, and it's important to understand that we joined the program due to the fact that many of the HIV positives are living in the field of Tel Aviv-Yafo. Many, not a low percentage, a kind of high percentage of the new detach are happening in the city, similar to big cities around the world. And the biggest AIDS center in Israel is located in our in municipality hospital, Ichilov, and the municipality already proven her obligation to the subject by actually giving two buildings to activate HIV testing centers that activates all around the year. And I have to also add to that the international status that Tel Aviv gets to have in the last 10 years as an LGBT capital that is March as one of the amazing place to visit in the world as being LGBT. I have to say that the data says that over 40% of the tests that are HIV positive are from the center that in Ichilov. So many of the new detentions are in Tel Aviv. And we're so proud to be a part of this international program because it allows us to be an international metropolitan as we are in different subjects, but also in this life-changing event. I have to say that it's not just concerning community, it's also concerning the pioneer seekers community that we have in Tel Aviv and other communities that are affected by HIV that you probably also know and taking care of. And I believe that our future challenges, and maybe we'll talk about it a bit later, is the gaps between the generations. We all remember the generation of the 80s and the 90s by just receiving the first victims of HIV. And we have a new generation now that actually has a different relationship with the virus, and we have new challenges in prevention sectors. I think that this is the main challenges we see here on the ground. So I would love to learn what is your main challenge on the ground. I believe it's similar due to international problem that we all see. And this is like in short the 1990 program. We run it and we are close to achieving those numbers in Tel Aviv on the ground, I'm happy to say.
That's amazing. Thank you so much for that overview, and that really Tel Aviv is part of an international consortium that is ascribed to this 90-90 plan. John, how does West Hollywood utilize its zero plan in comparison to that 90-90? Maybe you can address some of the deputy mayor's questions around what are you thinking about and how to the next generation here. And then and in a little bit we'll bring in David Juni and Derek Murray from the city staffers to also address. But I'd love to hear from you about this.
Absolutely. So I think it's worth maybe just a small amount of context. In 2015, my former colleague John Duran and I, who were, John is no longer on the city council, but two of maybe 4 or 5 out HIV positive elected officials in the country. And we, a whole series of things, but two of the major ones is we noticed that there was a lot of sort of HIV fatigue after 30 years, and men our age, women who have been living with HIV or helping people with HIV to survive, just really were sort of exhausted by the sort of endlessness of this existence. And yet, around the beginning of the last decade, 2010, 2011, 12, there were actually new technologies in HIV care. It was the sort of one pill moment where you would take 1 pill a day. There was a time in my own HIV care where I took 26 pills a day and chewed 2 chalky tablets. But I'm alive, right? It wasn't such a terrible thing. It kept me alive. But the sort of new technology of the last decade in HIV also brought us PEP, post-exposure prophylaxis, and PrEP, which is pre-exposure prophylaxis. And I think it sort of opened a window mostly for a younger generation of men who have sex with men, women, trans women, people who use drugs, who are really at risk for HIV in our community. It opened a window for them about ways to take care of themselves, ways to engage with the sort of conundrum of HIV, but not feel immediately overwhelmed. If you get that 1 pill into your body once a day, you're pretty good. You get to have a sort of longer, more regularized life living with HIV. And I think that was the sort of moment in 2015 where John and I decided that in our little city, and really this was happening in some cities around the country, San Francisco, New York City, we wanted to join the HIV zero movement, which was to sort of target 0 new infections, 0 new AIDS diagnoses, and zero free-floating HIV in the community. And we all know that it's people who are, by and large, people who are who don't know their HIV status, who don't or do know their HIV status but are not in treatment, are really the cause of most new HIV infections. So we really wanted to drive that down. I think David and Derek will show us some really great data about doing that. Some of it mixed, but most of it really terrific sort of effort in that direction. And I think it's also worth sort of saying that in West Hollywood, our target populations remained sort of primarily gay men, bisexual men who have sex with men, people of color who are in that category. You know, sort of our city is the residents, 10% of the residents are HIV positive, but really we're a draw for young gay and bisexual men of all races and ethnicities to come and have fun in our city. So we're often thought of gently as a vector for HIV transmission. You know, people sort of come from two different parts of our county and meet in one of our bars and end up in some other part of the county perhaps, or one of those two parts. And so we really wanted to work on targeting gay and bisexual men that are HIV negative in prevention efforts. Certainly our trans population, trans women, mostly who may or may not engage in some kind of sex work or some kind of transactional sex. We really wanted to sort of destigmatize the transactional part of it and really work to enable and encourage people to get involved in HIV prevention, PrEP, PEP, really sort of know their status and know their HIV status. And then people who use drugs. You know, our city, sadly, the LA County, really all of America has a terrible drug problem. And specifically in West Hollywood, there's a lot of methamphetamine use. So in terms of people who are HIV negative, those were our sort of three populations of people. And then people who are already positive, whether like me, you're positive since 1987 or 88, or just recently diagnosed, you have to get into treatment. And we had to break down the barriers to access to treatment. And you know, Israel is far ahead of us, as are many countries, in terms of their access to healthcare for its residents. In Los Angeles County, in California, we are finally sort of turning the corner with access for everyone with Obamacare and the Affordable Care Act. The number of people who cannot access HIV care or care generally is approaching zero, and that is a huge help in our effort to reduce HIV transmission. HIV care has increased, and access to care generally. So from people who are HIV positive, we're really looking at ideas of stigma, of how to make sure that whatever your sort of presenting set of ideas about yourself are to your doctor, that you have a lot of confidence about it, that you have a sense of belonging, and that you understand that getting into care and being in care is really the best thing that you can do for your HIV. Not running from care, not shying away from presenting who you are to your doctors. And so we've worked very hard at destigmatizing HIV. We have several newly established healthcare clinics in our city that are really looking at how to get people into care through the avenues I just said, the Affordable Care Act, the AIDS drug assistance program, et cetera, through the state. And then really just at a very micro level in West Hollywood, you know, we have small programs that help people get signed up, that get into care, get to one of our local clinics, and hopefully send them on their way for a lifetime of taking their one pill a day and having a long life. So I think there was a question about what is the future and how do we really sort of look at where this HIV zero effort might go. And I think David and Derek will talk a lot about it, but I wanted to say that we know that young men of color, specifically young Black men in Los Angeles County, in fact, around the country, are really at the highest risk. There's, I guess my mail is being delivered. I guess what we know is that Black men are at a 50% risk of becoming HIV positive. And we have to turn that around. And we have to turn that around immediately. And I know in our own city, we are committed to that goal of really, really making sure that young Black men who come to West Hollywood or live in West Hollywood or somehow in the West Hollywood story, that they know that they have access to prevention if they're HIV negative and care if they're HIV positive. And so I would sort of leave it at that. I'm happy to talk about any of the things I mentioned.
Thank you, John. That's amazing. How many similarities between, you call it 90-90-90 or zero. How many similarities in kind of the plans that you both are leaders of making sure happen, and the importance of the enrollment of the municipalities in educating, and both so ironic. Both John and Hank, you've both identified that people come to your communities from outside. They may not live in Tel Aviv. They may not live in West Hollywood, but each place has really the major standard of care in terms of both education and prevention and cure. Let's bring in now two city staffers from the city of West Hollywood, David Juni and Derek Murray, who welcome. Thank you for being here this morning and with us, and talk to us a little bit more deeply about the facts and figures that Councilmember D'Amico described.
So I'll jump in. I'm David Juni. I'm the social services manager for the city of West Hollywood, and just want to thank you, Dylan and Rabbi Egger, so much for including us in today's discussion. To kind of further what Councilmember D'Amico shared, the city of West Hollywood, as he mentioned, was incorporated in 1984, which is the height of the AIDS epidemic, and really right away began to face that epidemic and pull in its contracted agencies, strategic partners. The first grants that the city gave with general funds were for HIV testing and prevention through the LA LGBT Center, and that continues. The priorities of the city have always been to address this epidemic, and continues. As Councilmember D'Amico mentioned, with former Councilmember Duran, they gave direction to staff to put together the HIV Zero initiative. And we really looked to the structure that was, that was already in place through our contracted agencies, what we refer to as the strategic partners in the plan. So compare this with the 90-90-90 plan of the fast track cities, there are 4 overarching goals of the HIV Zero plan. The 4 goals are to, as mentioned, expand access to healthcare, to obviously reduce new HIV infections, to reduce HIV-related disparities and health inequalities, and then to slow disease progress from HIV to stage 3 AIDS. Derek's going to share a little bit about how we've had some successes and what challenges are still to come. As Councilmember D'Amico mentioned, this was really in 2015 when they gave this direction to staff. We knew that we really could look at zero due to the phenomenal progress in biomedical interventions, and that we knew we need to have to take this opportunity through our providers, and providers such as AIDS Project Los Angeles, Men's Health Foundation, the centers, the LA LGBT Centers Health Services, and at that same time we got into a contract with Planned Parenthood LA. So we made sure that we were trying to hit all of the demographics of the city, and then also make services available for folks who come to West Hollywood, who look to West Hollywood, especially the LGBT community. So we brought on those contracts and expanded services, made more access to healthcare, were able to provide more access to PEP and PrEP, and really began to look at seriously on how do we address stigma. Because with HIV, as we all know, there has and continues to be a stigma around the disease itself and around folks who are living with HIV. So we knew that that was a big piece of this on how do we address stigma, and then by addressing that, make all these services more available to our community. So I'll turn it over to Derek, and he can give us a little bit of an update where we've had successes, where we continue to see challenges. And thank you once again for inviting us.
Hello, everybody. So to date, the city and the research team have implemented data collection requirements with our strategic partners. We've collected and analyzed HIV surveillance from the County of Los Angeles and completed 6 biannual community surveys on stigma. So I'm going to highlight the progress to date on the 4 goals that David just stated. But keep in mind that the data is from 2018, which is the most recent year the County of Los Angeles can share with us. Our Centers for Disease Control requires 2 years of curing before the county can share surveillance data. And then also with COVID, there is going to be another significant delay with getting 2019 data. So for goal 1, access to healthcare, in West Hollywood, gay and bisexual men aged 18 to 44 were the most likely to acquire HIV and were the least likely to have health insurance. In 2018, West Hollywood surpassed that goal with 87% of men aged 18 to 44 having insurance. For goal 2, our HIV infections continue to decline in West Hollywood. 99% of new infections are among gay and bisexual men in West Hollywood. Now, this isn't the same as countrywide, just specifically in the city. In 2016, we set a goal to reduce the number of newly diagnosed by 15%. So that's from 77 infections per year at baseline to no more than 66. And as of 2018, West Hollywood has only had 27 new infections. For goal 3, our HIV-related disparities and health inequalities, we've had mixed results. For people living with HIV, linkage to care, retention in care, and viral suppression has declined. In 2014, 92% of those that were diagnosed with HIV were linked to care. But in 2018, that linkage percentage is at 78%. The retention in care, which is folks staying in healthcare, has also decreased. That percentage was 60% in 2016 and is now 51% in 2018. Also, viral suppression rates declined as well, with 67% of those living with HIV virally suppressed in 2016, and in 2018 that number is down to 62%. Lastly, for goal 4, reducing AIDS diagnoses, we've achieved tremendous success there with the rapid reduction in diagnoses. The reduction has gone from 24 in 2015 to 10 in 2017. So we anticipate these numbers will continue to decline in the low single digits in the next few years. So despite the successes with healthcare access and most importantly, HIV and AIDS diagnoses, disparities in health inequalities continue to be a challenge. And that's a challenge across the board. It's a global challenge. It's a nationwide challenge. And although the data on disparities in our city are concerning, it's also encouraging because it indicates where we need to focus our attention. As David mentioned, we're a funder. We were on a 3-year funding cycle, and in 2019, we brought on additional providers to complement the HIV Zero initiative. So with that said, the latest surveillance data that we have is from 2018, so it's going to take a little bit of time to see if the work that we're doing right now is improving the linkage retention and viral suppression rates. Lastly, I want to talk a little bit about how we measure stigma. As of 2021, we have completed 6 waves of the survey on stigma. The purpose of the survey is to establish a baseline measure of attitudes and experiences community members have when it comes to interacting with healthcare providers, HIV-based stigma in intimate relationships, PrEP awareness and use, and discrimination based on sexual identity, gender identity, and HIV status. Which are all social determinants that may contribute to stigma and increase the risk for HIV infection or compromise a person's capacity to adhere to treatment. So with this survey, what we found in West Hollywood is that those living with HIV maintain 90% comfort rating in a healthcare setting. And those who are HIV negative, there's an 80% comfort rating in a healthcare setting. So health access and comfort do not appear to be a large barrier to viral suppression or PrEP uptake in West Hollywood. So yes, this is contradictory from the surveillance data that shows a decrease in linkage, retention, and suppression rates. We're still trying to figure this out, what the disconnect is, and if there's any errors in the surveillance data that we're receiving from Los Angeles County. So overall, during the past few years of surveying, we have seen a decrease of stigma experienced in a healthcare setting. But the highest form of stigma that we found with people living with HIV continues to be with dating prospects and intimate relationships, with online hookup apps being a fuel for this type of stigma. Secondly, the second highest form of stigma we have found is in the employment setting and pertaining to sexual orientation and gender identity, and not to HIV status. So that's why it's so important for the city, providers, and the community, first of all, to spread the message of you equals you, undetectable equals untransmittable, and to really work on and partner with campaigns with local agencies to keep that message going. And secondly, it's important to train employers on sexual and gender diversity gender and sexual diversity. So in 2019, we entered into a contract with an agency to train at least 60 employers each year on sexual orientation and gender identity. So we hope to see these numbers improve with stigma. And that's it for me. I just barely brushed the surface of all the data that we have. I try to rush through it, but of course, if you have any other questions, I'm happy to answer
We're
them.
so grateful. We're so grateful, Derek and David, for your incredible efforts to carry out the plan that our council members had with such foresight, with John D'Amico and former council member John Duran and the rest of the city council, to put this in place, and how you're really trying to not only make a difference by connecting people, but to measure the impact of the policies and the programs. And that's really such important information. So we're very grateful for you being here today. And I want to have us have an opportunity to hear from one of Israel's great medical researchers and leaders. And so we'd like to welcome and bring in now, Dylan, Dr. Tzvi Bentwich. Dr. Bentwich, welcome to our West Hollywood Tel Aviv Dialogue. Dr. Bentwich, I'm so honored to meet you. I've heard so much about you. Professor Bentwich is the director of the Ben Gurion University of the Negev's Center for Emerging Disease, Tropical Diseases and AIDS. He is one of the leading HIV/AIDS researchers. So welcome. Tell us and talk to us about research and developments in Israel on HIV, and maybe a little bit about what you're learning from the COVID-19 HIV intersection. Welcome.
Thank you very much. Just to make sure, how much time am I allotted in this panel? Oi.
Professor, you can take up 10 minutes or so to give opening remarks, if that's okay. Is that okay?
Okay.
Perfect.
Yes, definitely. So just to put this in perspective, I was the first physician researchers to deal with AIDS back in 1982. So I have the perspective of saying that we have made quite a long way since then. Unfortunately, I listened carefully to the previous presentation on the situation in Los Angeles, Hollywood. We obviously have a very different healthcare system in Israel, and I would say that fortunately, because healthcare is available to everybody, and it covers obviously all antiretroviral treatment, more or less from the beginning. And so on that element, on that part, including, by the way, including more recently PrEP, so people with HIV on that element, on that aspect, have a very reasonable and I would say optimistic vision. So, secondly, as you probably know, more or less half of HIV carriers are currently in Israel are of Ethiopian origin. So, in other words, the incoming immigration from Ethiopia has brought with it quite, at least relatively, a large proportion of HIV carriers at that time, and it still consists more or less of 50% of the 8,000 more or less HIV carrier currently in Israel. However, and that has been, I would say, a very impressive achievement in this regard, that despite the fact that they came from a very different cultural, ethnic, whatever background, we have succeeded in having all of them, or more of most, the vast majority of HIV carriers of Ethiopian origin, taken care under the current system and with all the difficulties that it entailed. And looking at the end result, generally speaking, the success of viral suppression to a significant and acceptable measurement has been achieved. So, for instance, there's practically no children born to HIV, no children get infected born to HIV carrying mothers, and essentially life expectancy of the current HIV carrying community is almost as good as the relative normal Israeli population. And as you know, life expectancy in Israel altogether is something around 80, above 80 years old. So this looks very, very positive. One, I think, two major points I want to make on the scene is that stigma is still a major element. And just as an illustration, HIV carriers that have come out publicly revealing their status can be counted more or less on two hands, or I don't know, in tens, not in hundreds and not in thousands. So it's still a major problem. Second, I think the Israeli AIDS Task Force, which is the sort of the common denominator of HIV carriers and making, or is the public most active NGO, has been very successful in at least changing the public attitude to HIV carrying situation as something that has been accepted as a chronic disease rather than a deadly, frightening menace to the population. So I think these two major things, I think, have been a great achievement. I want to, just because of the constraint of the time, I want to say two additional things about Ethiopia. And the reason I'm saying that, as you heard, I'm at the head of the Center for Tropical Medicine and AIDS. And the reason being that my exposure to the Ethiopian immigration with the HIV carrying population has led me to, I would call it, a major change in my research activities and interest. And that has been that when we first saw this population coming into Israel, I was immediately impressed with the fact that the vast majority of immigrants were co-infected with, aside from HIV, by helminths. Helminths meaning intestinal parasites. Schistosomiasis, bilharzia is another name for that. And that led, and again, to make a long story shorter, that made me getting involved in the studies and several publications on that matter, showing that the helminth infection, which is more or less very commonly prevalent in Ethiopia, as numbers go, one would say on the mean prevalence of these infections in the total population of Ethiopia, which is over 100 million, is something of the order of 40 to 50%. And in other words, in some areas, it's reached 100%. And the message that our studies carried was that these infections impact or change or skew the immune system so much so to make the host more susceptible to get infected and less able to cope with it. And so that led to my getting involved in the idea that you have to eradicate or to control these infections if you want to diminish the spread of the infection in Africa, of course. And so our organization, and I've since then established the NALA Foundation, which is an NGO, is very active in Ethiopia. And so we have reached literally millions of children. And by now we have become a sort of an official supporting arm of the Federal Ministry of Health of Ethiopia in controlling and overcoming what we call neglected tropical disease. Although it is not exactly the HIV story, but it came out of the HIV story. And for those of you that are sort of familiar with the idea of Tikkun Olam, namely that our role in life is not only to take care of ourselves, but to take care of others, and be it not necessarily only Jewish people, but the world needs that help as well. So I want to impress upon you that we have been very active in Ethiopia for trying to control these diseases, which are part and parcel of poverty and poverty, which is a key to other elements of our existence. Having said that, and again, because of the constraint of time, I want to touch on one additional element, and that is the COVID. And the reason I'm saying that is because the lessons that we have learned from our involvement in HIV, starting from HIV, and then this neglected tropical disease, is a common denominator. And the common denominator is that infectious disease, a major key to overcoming, meeting the challenge of infectious disease, and again, in this immediate issue of COVID, has to do with human behavior. If you change human behavior, you can overcome several of these infectious diseases. It is, in the case of COVID, social distancing, masks, washing, hygiene. These are common denominator to coping with neglected tropical disease. It is the lessons that we have learned from these infectious diseases that can allow us or can enable us to overcome or to try and overcome and change human behavior, so much so that they can cope with an oncoming threat like COVID. So social distancing, mask wearing, washing hands, social hygiene and prevention are a key element in coping with this new epidemic. But that has a direct link to coping with infectious disease in general. And if we can change behavior, we can achieve a lot. I've heard many times the lesson that if we as doctors could achieve behavioral change, and a large proportion of our major health problems would be solved. Now, lastly, and again, because of the time, I don't want to take more time, I would say that there are several groups in Israel that are involved also in HIV research, and I would just cite three of them. One is dealing with the microbiome, that is the bacterial colonies that all of us, harbor in our intestine, in our gastrointestinal system. And there's a very elegant work that has shown that the microbiome plays a role in the pathogenesis of HIV. In other words, change of the microbiome can make a difference in terms of susceptibility and progression of HIV infection. So this is one group that is focused or is located in Weizmann Institute and is led by a guy called Eran Elinav. The second group, which is in Ben Gurion, deals more with the issues of the control of latency of the HIV virus. And as you know, one major element that has not been overcome yet, and that is we are not able to eradicate HIV infection. We have achieved a lot in suppressing the infection, in decreasing its impact, but we have not been able to eradicate, to clear the body of the virus. And the key, one of the keys, of course, is the way if we can change the latency, if we can liberate the virus so as that we can eradicate it. And there is a group led by a guy called Ran Taube in Ben Gurion University, which has kind of leading investigation in this direction. The last group that I want to cite is there is I would say, an impressive clinical trials groups which are trying or are active in following up new developments in novel drugs, antiretrovirals, which in Israel has played kind of an important role. So I think I will leave you with this unless you have some more critical questions to ask me.
Wow, that you've given us so much to think about. Your work is amazing, and your leadership, we are so grateful for it. Maybe, Dr. Bedwich, you could comment on one aspect about. We know that some of these new vaccines came out of a different kind of viral creation, the mRNA research that drove this development of the new the Moderna and the Pfizer vaccine for coronavirus. Can you talk about that as a potential treatment for HIV? Does that hold anything in the future?
Well, I should start with a kind of a less optimistic vision, or I would say situation, and that is surprisingly to me as an immunologist and me as somebody involved for so many years in HIV, we have not achieved a potent HIV protective vaccine. So that's regretfully is a true evaluation of the current situation. However, and I'm glad that you raised this question, I think the story of the COVID vaccination is a dramatic story. And the reason I'm saying that is that I don't think any one of us, scientists, immunologists, HIV researchers, etc., have expected such at least a very compelling success of the protective vaccine for COVID. There's no question that what we see here is something that we did not expect. And it is true that this is the first representative of a new approach in vaccinology, let's put it this way. It has been tested in animals, but it has never been tested so widely and impressively as in COVID. So definitely the story of this success opens the door, at least for serious effort, to do the same with HIV. So I'm not trying to say that that's going to be a game changer like it has been with the COVID, but it is certainly something that I'm sure will be, we will hear about it in the very near future.
Well, Dr. Bedrich, thank you for such great enlightenment today and for being with us from Israel. And we wish you continued success and good luck in your research, b'chatzlacha. And I hope to meet you when I'm at Ben Gurion next May. I'm coming next year, so Ben Gurion. So I hope to meet you then. It's my privilege now to welcome Michael Sugar, who's a member of the Board of Trustees of Congregation Kol Ami and a longtime HIV/AIDS activist, was an original member of ACT UP here in the Los Angeles area, and continues to teach not only physicians and nurses about HIV and AIDS and their education, and will help us close our program this morning. Michael, welcome.
Thank you so much. Thank you, Rabbi and Dylan, for inviting me to be here today. And thank you all so much for your participation and your powerful words. Knowing more about the plans for our communities is an opportunity for all of us to be engaged. It's an honor to be here with all of you to celebrate Israel's anniversary and also to recognize the 40th anniversary of the first identified cases of what was to become known as HIV/AIDS. I'm especially grateful to be here as last month I celebrated 36 years since my own diagnosis. There have been impossible odds, particularly during those early years of the pandemic when treatment was in its earliest stages, and we all lost many, many friends. I'm certain that one of the reasons I'm still here is that I have purpose and an unquenchable thirst to know what happens next. And I have benefited many times over from the work and the tireless support of dedicated people like those we've heard from here today. I've participated in many clinical trials, and I've served on advisory boards. I've been an activist, and I've been an HIV educator, and I've learned firsthand in the trenches the power of collaboration. I have a profound awareness of the lives that have been enhanced and the lives that have been saved due to all of the people who have worked together in the most dedicated collaborations between the scientists, the doctors, the activists, and all of our collective allies who are tirelessly committed to the common goal of enhancing quality of life and saving lives. About 7 years ago, I attended the event at West Hollywood's Congregation Kol Ami, announcing the inauguration of this Israel-West Hollywood task force. The discussion that night about how to pool our efforts to enhance the quality of life for people living with HIV/AIDS was exciting and inspiring to me. We talked about how we can work together to improve patient care, to better find treatment methods, and to advance research. At that time, we could all agree that HIV/AIDS could be a chronic manageable condition among people in treatment, but we were not yet so freely using the word cure. Today, we're finally talking about prevention and cure in terms that I think we all believe to be viable and realistic, and we're making remarkable strides. Today's comments from Dr. Bentwich relating to the microbiome research, the viral latency study, and the role COVID-19 mRNA research plays in development of clinical trials for HIV are proof that ongoing collaboration between dedicated, passionate people in solidarity and with a common goal fills us all with hope. It's true that whoever saves one life saves the entire world. And I think I can speak for all of us now when I say I am as curious and as excited as ever to know what happens next. Thank you all again for your ongoing dedication in this powerful alliance, and shalom.
Thank you so much, Michael Sugar, for those really inspiring words. Really, Dylan Hosier, thank you for organizing this from the Israel Civic Action Network and for all you do. You're a wonderful partner with Congregation Kol Ami. To the City of Tel Aviv, Deputy Mayor Chen Arieli, and our own council member John D'Amico, we are grateful for all of your leadership and all of you do. David Juni and Derek Murray, thank you. Your dedication to your work and to the people of the city of West Hollywood makes a true difference. And Dr. Tzvi Bentwich, we are so honored that you shared your insights, your knowledge, your long-term dedication to people with HIV and AIDS globally around the world really helped to make a difference. Thank you for being here today. Dylan, closing thoughts.
So, Rabbi, I just want to thank you. Wow, I'm really moved by this program. I want to thank Councilmember D'Amico. As always, I love partnering with you and doing these great events with you. Great to have you join us, Deputy Mayor Arieli from Tel Aviv, and David and Derek. You guys are outstanding, stellar as always. And Mr. Sugar, really great to hear your closing remarks. Thank you so much. So I just want to thank you all for joining us here, and a happy birthday to Israel, and may this be the beginning of a great dialogue between Tel Aviv and West Hollywood from here on out.
We want to thank the Consul General of Israel and his staff as well for helping us coordinate today. So thank you, everybody. Happy Yom HaAtzmaut, happy Israel's 73rd birthday, and onward to a cure and to continue with the 90-90-90 and zero plan for West Hollywood together. Thanks so much from all of us.
Thank you.
Thank you. Thank you.
Thanks, guys.